Hello, and welcome to part one of Anatomy of the Ear. You may be wondering why we need to learn anatomy of the ear, and that's a valid question. Well, first, it's important because ear anatomy is part of the skull, and certainly we know that skull anatomy will be on your registry. But second, and almost more importantly, if you work in CT, you will image the organs of hearing and equilibrium, and it's very important that you know what you're looking at. So let's get started. The ear is divided into three separate divisions: the external ear, the middle ear, and the internal ear. And in this lecture, we'll begin by discussing the external ear. The external ear begins with the auricle, or the pinna, on each side of the head. You can see that here. The tragus is part of the external ear. The tragus is anterior to EAM, and it acts as a partial shield to the ear opening. The EAM is the opening or the canal of the external ear, and certainly we're familiar with EAM because we use it as part of our positioning. The external acoustic or auditory meatus is about 2.5 centimeters long, and it's about half comprised of bone and half comprised of cartilage. The mastoid process and the mastoid tip, which of course are part of the temporal bone, they are posterior and inferior to the EAM. The styloid process, however, is slightly anterior and inferior, and you can see that here, again, part of the temporal bone. The meatus narrows as it meets the tympanic membrane or the eardrum. And the eardrum sits at an oblique angle, which kind of forms a depression or a well at the lower medial end of the meatus. And again, you can see that relationship here. We're going to take a closer look at the tympanic membrane next. So the middle ear. The middle ear is an air-filled cavity located between the external ear and the internal ear portion. The three main parts of the middle ear are the tympanic membrane, which we know as the eardrum, the three small bones called the auditory ossicles, and you can see those here, and the tympanic cavity. Again, those parts make up the middle ear. The tympanic membrane is considered part of the middle ear, even though it serves as a divider between the external ear and the middle ear. So eardrum is considered part of middle ear. The tympanic cavity is further divided into two parts. The larger cavity that's opposite of the eardrum is called the tympanic cavity proper. And you can see that here on our diagram. The area above the level of the EAM and the eardrum is called the attic, or the epitympanic recess. So that would be this area. The tympanic membrane is attached to a sharp, bony projection known as the drum crest or spur. And you can see that attachment here. The drum crest or spur separates the EAM from the epitympanic recess. The tympanic cavity communicates anteriorly with the nasopharynx, and you can see that here, by way of the eustachian tube or the auditory tube. So let's talk about that eustachian tube in a little more detail. The eustachian tube is the passageway between the middle ear and the nasopharynx, and you can see it again here on the diagram. This tube, the eustachian tube, is about 4 centimeters long, and it serves to equalize the pressure within the middle ear to the outside atmospheric air pressure through the nasopharynx. And so that sensation of one's ear popping is caused by that pressure being adjusted internally to the middle ear, and that prevents damage to our eardrum. A problem associated with this direct line of communication between the middle ear and the nasopharynx is that disease organisms have a direct passageway from the throat to the middle ear. Therefore, ear infections often accompany sore throats, especially in children whose immune systems are still developing. Next, the mastoid air cells. The mastoid air cells act as a second direct line of communication into the middle ear. The adytus is the opening between the epitympanic recess and the mastoid portion of the temporal bone. So remember, this is all temporal bone, and the adytus would be that separation or that opening between the epitympanic attic and the mastoid air cells. The adytus connects directly to a large chamber within the mastoid portion of the temporal bone called the antrum. You can see that here. The antrum connects to the various mastoid air cells, which you see here. This communication, however, allows infection in the middle ear, which may have originated in the throat, to pass into the mastoid area of the temporal bone. Infection within this mastoid area is separated from brain tissue only by a thin piece of bone. And before effective antibiotics were commonly used, this was often a pathway for encephalitis, which is a serious brain infection. This thin plate of bone that forms the roof of the antrum, the adytus, and the attic area is called the tegmen tympani. So again, this thin piece of bone is all that's separating brain tissue from the mastoid air cells. And remember, infection can travel through the eustachian tube into the middle ear, into the mastoid region, and then it could transfer into the brain. Okay, let's talk a little bit about the auditory ossicles. The auditory ossicles are the three small bones within the middle ear. And these are parts of the ear that you probably remember learning as children. These bones are situated in such a way as they allow for vibrations to pass. The three auditory ossicles are located partly in the attic, or the epitympanic recess, and partly in the tympanic cavity proper. So again, if you were to divide the middle ear, the top half is the epitympanic recess, or the attic. The bottom half you can think of as the tympanic cavity proper. These delicate ossicles or bones bridge the middle ear cavity to transmit sound vibrations from the tympanic membrane, or the eardrum, to the oval window of the internal ear. Vibrations are first picked up by the malleus, meaning hammer, which is attached directly to the inside surface of your tympanic membrane. The head of the malleus articulates with the central ossicle or bone, the incus. And you can see that here. The incus got its name from a supposed resemblance to an anvil, but it actually looks more like a tooth, which we'll take a closer look in the next slide. The incus connects directly to the stirrup-shaped stapes, which is the smallest of the three auditory ossicles. So the stapes is here, and again, it kind of looks like a stirrup. The bottom of the stapes is attached to another membrane called the oval window, and that leads to the inner ear. So let's take a closer look at these ossicles. Looking at the frontal view here on the left, and the lateral view of the three ossicles here on the right, you can see that the malleus is the most lateral of the three bones, where the most medial is that stapes, that stirrup-shaped ossicle there. If you look at the lateral view, this is how the ossicles would appear if one looked through the EAM. Okay. The malleus, with its attachment to the eardrum, sits slightly anterior to the two other bones. Okay, so this is as though we're looking from the inside out. The resemblance of the incus to a premolar tooth with a body and two roots is well visualized here on the lateral drawing. You can kind of see that here. The longer root of the incus connects to the stapes, which you can see here, and the stapes, remember, connects to the oval window of the cochlea, and we'll talk about that coming up shortly. These articulations and relationships result in the sense of hearing. Okay, we're going to pause here. We will pick up in part 2 with anatomy of the internal ear.